Every time you walk, run, climb stairs, or even move your body with purpose, your heart is getting trained. Exercise is not only about losing weight or building muscles, it directly strengthens the heart, improves blood flow, lowers blood pressure, and reduces the risk of serious conditions like heart attack and stroke. So how does exercise actually protect the heart? The heart is a muscle, and like any muscle, it becomes stronger when used regularly. During exercise, your heart beats faster to send more oxygen-rich blood to your muscles. Over time, this regular demand makes the heart more efficient, meaning it can pump more blood with less effort. Exercise also improves the health of your blood vessels. Healthy blood vessels are flexible and allow blood to flow smoothly. Regular physical activity helps reduce stiffness in the arteries, improves circulation, and supports better blood pressure control. Another major benefit is its effect on cholesterol. Exercise can help increase HDL, often called good cholesterol, while helping reduce harmful blood fats. This lowers the risk of plaque buildup inside arteries, known as atherosclerosis, which is one of the main causes of heart attacks. Exercise also helps control blood sugar. When muscles work, they use glucose for energy. This improves insulin sensitivity and lowers the risk of type 2 diabetes, which is a major risk factor for heart disease. Physical activity also helps reduce body fat, lower inflammation, improve sleep, and manage stress. These effects matter because obesity, poor sleep, and chronic stress all place extra pressure on the cardiovascular system. The understanding of exercise and heart health has grown as scientists studied how physical activity affects blood pressure, cholesterol, metabolism, and heart function. Today, exercise is considered one of the most powerful tools for preventing cardiovascular disease. But exercise does not always mean intense gym workouts. Brisk walking, cycling, swimming, stretching, sports, or even consistent daily movement can support heart health. The key is regularity. A body that moves regularly gives the heart a better chance to stay strong and efficient. Today, artificial intelligence is helping people use exercise more safely and personally. Smartwatches and fitness trackers can monitor heart rate, activity levels, calories burned, sleep, and recovery. AI systems study these patterns and can suggest whether someone is improving, overtraining, or showing unusual heart rhythm changes during activity. In healthcare, doctors can also use this data to create safer exercise plans for people with heart disease or high risk. Exercise protects the heart by strengthening it, improving blood flow, lowering risk factors, and supporting the body's overall balance. It is one of the simplest and most powerful ways to reduce the risk of heart disease. But even with a healthy lifestyle, doctors still need better tools to detect heart problems early. In our next video, we'll explore how AI detects heart disease.